So earlier, we talked about the surge of COVID-19 cases in some states. Here is the map. Again, I'm not sure if we did talk about this, but we're talking about it now for the first time. The increase is happening in 14 states, and many of those states were ones to reopen early, like Utah, Arizona. Now some experts say reopening is to blame. However, President Trump recently told press the rise is because of the increase in testing. So of course cases will rise. Well, joining us live is our expert, Dr. Payal Kohli in Boysenberry, looking absolutely fabulous, and I know she's going to tell us how to make sense of this. Doc, is testing or reopening to blame, or is it both?
Actually, Tori, it's both. So President Trump is right that part of the increase is explained by increased testing. But in my opinion, that's a very small part. And I think the majority of it is that there's actually an increase in cases. And there's two reasons that I believe that. The first is that all states have actually increased their testing, but we're not seeing these rising number of cases in all the states. We're only seeing them really in those states where people have been moving around more because they've relaxed the restrictions greater than 2 weeks ago, and because they relaxed the restrictions without the White House gating criteria. And then the second reason is that 12 states are actually seeing increased numbers of hospitalizations. Now, we know that testing can depend on how much we're looking, but hospitalizations is definitely a metric that reflects disease activity. So people only end up in the hospital when they're sick, and so the fact that more people are ending up in the hospital means that more people are getting sick.
Mm-hmm. So, Dr. Kohli, obviously this is concerning to a lot of our viewers because they're wondering, does this mean that those states could be shut down again soon?
You know, I'm concerned about that too, Erica, because right now it's just a spike in cases, but pretty soon a spike can turn into an outbreak like it did in New York City in February. And then we end up having many little epicenters throughout the country. We can very easily overwhelm our medical system, which, if you recall, was the reason that we shut down in the first place. And in fact, on Monday, Arizona announced that they're already using 76% of their ICU beds at capacity. Whoa. So I'm concerned because what we're seeing now is the effect of Mother's Day, Memorial Day, graduation parties. But remember, we just had all these protests in the last 2 weeks, so we expect that there's going to be more cases in the next coming weeks. And I'm concerned if the hospital system's not able to accommodate it, we are going to have to shut down.
That's when the worst happens, when we overwhelm the hospital situation, as you've taught us. All right, Doc, what should other states learn from this, right? What is the takeaway here?
Yeah, it's important. I mean, this is a new thing we're venturing into, but we have to learn from our mistakes. And the mistakes are, if we take too many shortcuts, we're going to get burned and we're going to pay a bigger price. So the lesson to learn is look at your metrics before you open up. You know, make sure you have decreased hospitalizations, decreased deaths, make sure you have enough ICU beds, make sure you have the tracers. Remember those 3 T's, testing, tracing, and treatment. Get those lined up. And us as individual citizens can continue to do our part by socially distancing and remembering that this is not yet over. Even though summer's here, we gotta stay on the ball, you guys.
We gotta listen to the doc. We have to. Thank you, of course, Dr. Kohli. It was lovely to see you. We'll be back tomorrow, of course. And if you have a question about coronavirus you want answered, write us on social media and the doc can answer it. You can email us at info@dailyblastlive.com.